like the Navy, the Army also has its own behavioral health data portal. And again, the same thing applies, that from a research perspective, these can be, researchers tend to really like being able to work with, if you're an epidemiologist, for instance, there can be some really great kind of longitudinal research opportunities, because you have, in civilian world, you almost impossible to get, complete longitudinal health data on an individual. It's very, very, very challenging. So anyway, so the behavioral health clinical programs at all Army institutions are to deliver integrated behavioral clinical services across, so this is a quote from the BHDP program, wellness continuum, including transition from active duty to retirement and veteran services, Army force generation and deployment cycle, and soldier life cycle, initial entry through exit of service. So kind of covering, sort of the reverse order here, but no, I'm sorry. So wellness across the different kind of phases of Army service, deployment cycle, and then what they call soldier life cycle, and initial entry through exit through service. Okay, so the mission is to, under their mission statements, improve clinical care and risk tracking through standardized data collection and real-time data synthesis, and provider viewing capability, meaning that Army behavioral health providers with the proper credentials can utilize the behavioral health data portal for different data and research type of inquiries. Okay? In addition to, of course, properly, if they're directly involved with an individual as a client, then they have access to this through those specific records as well. So support adoption of evidence-based methods through outcome data in routine clinical, behavioral health routine clinical care. In other words, all these clinical behavioral health clinical encounters are archived in the data portal, and the research and analysis done on that available data is used to, according to the mission of the BHDP, to continually improve evidence-based, or an understanding of evidence-based methods, what works the best, what's most efficacious. And then reduce stovepipe databases by integrating relevant data sources. Again, although it's certainly not as simple as I'm saying it, there should be, one of the things that the BHPD is kind of charged with doing is making sure that all that particularly behavioral health relevant data is collected and housed and provided in a way that people can do analysis and research for the purposes stated.